Hello and welcome to Middlesex. My name's Mariama Sirewuri and I'm the Director of Programs for the BSc Nursing Programme with specifically for the adult field. But this presentation is going to cover what you'd be doing in nursing irrelevant of the field that you're going to be studying for. And then after, I've got a couple of my colleagues here with me, Fiona Southers and Josh Sharman, who work in our skills lab, and they're going to give you a whistle-stop overview of what we have to offer you in our skills lab. My presentation is just going to talk a little bit about our nursing program. So here we go. So it's all about pre-registration nursing at Middlesex, and hopefully you'll be able to join us in September. So this is just a quick video that just gives a quick overview of our nursing program. It's about 2.5 minutes long, so I just want you to watch through the video, and then I'm going to pick up a few things, a few points on the video with regards to what you'll be doing with us over the 3 years. Okay, so thank you for seeing that. So that's just giving you a whistle-top tour of what your 3 years at Middlesex University would look like, and also beyond your 3 years. Because one of the things I'm really proud to say, being part of the Middlesex community, is a lot of our students actually come back to do their postgraduate study with us, and also up to doctoral level. So one of the things that we're very proud of here at Middlesex is the fact that we work as a community in terms of with you as the student, and also with our service user involvement. So we do have service users involved in our program in terms of the program development, student recruitment. So in terms of the student recruitment, that was when we were doing before pre-COVID, when we were able to do face-to-face interviews. But our service users have also been involved a lot in our program development. You'll also find that we have students, in terms of student assessments, as well, we have our service users involved. The other key thing in terms of the, this is just an overview of the curriculum, which is actually divided into 5 segments. So we've got practice, we've got nursing knowledge, we've got nursing science, we've got professional nursing knowledge, and expensive learning. And so those are the themes that will follow through the whole 3 years of the program, and you'll be studying those specific modules across the 3 years at different levels, starting from year 3 if you're undertaking the 3-year program. One of the key things as well, if you come to study with us at Middlesex, is the innovations that we have in teaching. And shortly after my presentation, Josh and Fiona are going to go through some of the innovations that we've implemented in our curriculum. And again, a lot of those things that we've actually implemented sort of sits quite nicely in this post-COVID era, where we're having to do a lot of delivery of things online. Some of the unique things that you'll find, we have our K9 teaching assistants, and they've made headline news recently because there's been a little publication written about them in the nursing standard over the past week. And our K9 teaching assistants are here to help students across the university and not just within nursing. We've got our virtual and augmented reality, which Josh would be talking about. We also have things like our Equality and Diversity Forum. In terms of other activities that we can get students involved in, we have our interprofessional learning and workshops, Runway to Leadership, and also Scholars at Work. We also tend to invite a lot of our clinicians and work quite closely with our clinical trust partners. One of the things that's also core to the course is half of the course, so it's a 50-50 course in terms of 50 theory and 50 practice. So the 50% of the program is actually assessed in clinical placements. And you'll have the opportunity to undertake these placements at the forefront of some of the leading hospitals in London, such as the Royal Free NHS Trust, North Middlesex Hospital, the Royal National Orthopaedic Hospital, as well as some of the big community placements as well, with regards like in terms of the mental health placements, and we also use the private sector. In terms of your practice assessment, one of the key things is that the student is at the heart of the assessment. When you're being assessed, you'll have contribution from academics, from clinical placement, as well in terms of the practice assessor, and also the practice supervisor. So there's a lot of people that's going to be involved in your education and in assessment of your clinical practice as well as your theory. But one of the things that we do pride ourselves in is putting the student in the forefront of the assessment. So again, as part of your learning opportunities that you'll have, we do offer a varied range of practice placements, including things like in the community. There'll be GP surgeries working with learning disabilities. We also offer placements in the prison services, hospices, forensic placements, as well as charities. And just for me to sum up in terms of the benefits that you have when you come to us at Middlesex, a lot of the feedback that we get from our students is that we're very supportive in terms of how we nurture our students and how we guide them through the course. And this is one of the things, you know, that we really pride ourselves. We really pride ourselves with, and it's actually come to the forefront for me as the director of programs during this period where we've had to move to online teaching, in terms of the level of support that we've had to give the students in a virtual world, and the feedback that I have had regarding the students and how they've been felt supported by our team. So we're always looking to also develop our students. So with our current students, even though things have changed, we're always making sure that we upskill them. So even if you are on our program, our curriculum tends to evolve with the changes, and we also make sure that we incorporate those changes. So I'm looking forward to you coming to study with us at Middlesex, because you'll get to meet such a very diverse team of lecturers. So I'm now going to hand over to Josh and Fiona, who are going to tell you a little bit more about our skills lab and also our augmented and virtual reality, and some of the learning opportunities that you'll have from that, from that department. So thank you for listening.
Hi, my name's Josh. I'm one of the lecturers in clinical skills at Middlesex University. I'm going to start off by just showing you a video. Usually when you could come in on these open days, you could actually see the equipment we've got. So we've created a little short video for you to watch just to show you the type of equipment that we do have. Once we've finished this video, then I'll go over a few pieces of equipment in a bit more detail with you.
Middlesex University Clinical Skills and Simulation Area.
Hi, I'm Josh. I'm one of the lecturers in clinical skills and simulation here at Middlesex University. As a student with us, you'll experience state-of-the-art technologies such as augmented reality, virtual reality, and simulations, all which will be used to make that transition into practice easier for you.
Here at Middlesex University, using augmented reality will help you and will provide you with experience to see anatomy and physiology in such an amazing way you have never seen before. Moving from textbooks to you experiencing and seeing the anatomy and physiology. Plus, it helps you to connect theory to practice and also provides you with a safe environment where you can practice some skills that are better practiced in a mannequin before you go to the clinical area.
We try to make it as real as possible. We want the students to feel that they've had the opportunity to practice in an environment that is as close as possible to the clinical area. As well as our planned sessions that we run as part of the curriculum, we have drop-in sessions where we have a room that's available for the students to practice clinical skills as often as they like and as regularly as they like. This gives everybody the opportunity to feel as though they're as prepared as possible before they go into clinical practice.
Middlesex University is one of very few in London that will have the infrared visualization technology. It is used to visualize patients' veins in real time. Our students will get to use this technology within a classroom environment, and they will see this in the NHS Trust.
Hi, my name's Jane. I'm one of the technicians here at Middlesex University. One of the first skills that we'll teach you will be hand washing. We have some equipment that will highlight the bacteria left on your hands after hand washing to show you the effectiveness of your skills.
Hi, my name is Orla. I'm an associate lecturer here at Middlesex University as part of the clinical skills team. My background is intensive care nursing and I still work clinically regularly. The wonderful thing about our skills team is that we've got clinicians from all different backgrounds and they're still working clinically. So they bring back real life and up-to-date knowledge and skills into our teaching every day. So it's amazing having them. And the extra great thing about Middlesex is we've got these really high fidelity mannequins which simulate real life practice of patients deteriorating. So you can have a really sick patient in a clinical environment and we can do that in a safe space here that you can learn how to manage those very sick patients.
At Middlesex University, we have invested in equipment that will help you in your education. Not only is it a teaching tool, but we have found that the ability to influence the way you perform in clinical practice is increased. We have a strong passion to ensure you have a good learning experience, but also the ability to save lives.
So that was just a very quick presentation on the types of equipment that we've got here at Middlesex to help you with your learning. Just a few things to really point out. So previously we have offered skills drop-in sessions. So Monday to Friday, 9 till 5, you can come into these sessions and you can practice skills. All of the lecturers within the skills team are very happy to run one-to-one sessions with you as well. So we really do help those students that just need that extra bit of support. As you could see in that presentation, we've got some virtual and augmented reality equipment. As the university has progressed, we've noticed that actually we need more technology to help with learning. and the investment that we've made in augmented and virtual reality equipment really helps with bringing the textbooks to life. And I'll give you a quick presentation on Oxford Medical Simulation, which is a virtual reality equipment. So I've got some headsets that you can see here, and the students actually get to put the headsets on. And with this augmented reality technology, you can actually simulate the anatomy and physiology in front of you, which really, like I said, just helps with bringing the textbook to life. You can actually see and interact in an augmented world. Oxford Medical Simulation is virtual reality. So where that augments the environment, in virtual reality, you can actually put yourself in a completely whole different environment and try and interact with that. Bit difficult for me to show a presentation on because you can't physically see it as you would in real life, but I will try to demonstrate it to you now. If you just bear with me while I flick over onto that, because I've got to change computers, so just bear with me 2 seconds. So you can see here we've got, this is the virtual reality software that I was mentioning to you, where it puts you into a whole new different environment. And we've got adult simulations, we've got some pediatric simulations, we've also got mental health and some more adult ones. So a lot of different simulations you can do. This type of technology you won't really be using until you're in 2nd and 3rd year, but it really helps with that physical assessment that you'll be doing. And obviously you can use this as a screen-based platform as well. So you can use this whenever you want to. You don't have to come on site to use it. You can use it whenever you're free to do so. I'll just give you a quick demonstration on one of these scenarios.
Hello there, I'm one of the nursing assistants here in the ED. I was wondering if you could come review a patient, Wilfred. He's 78 years old and he's just arrived by ambulance. I don't have any history on him, but he seems really confused. He was found wandering on the street. He's here on his own, but I think he has a daughter at home. He keeps asking for her.
Who are you? You're not Janice. What am I doing here? I really must get back to work.
Wilfred, you're in the hospital at the moment. You were brought in by ambulance to the emergency department. We're going to take good care of you.
The hospital? Oh, that's the most ridiculous thing I ever heard. Where's Janice?
So as you can see with this, what you would be doing is you'd be wearing your headset so that you could actually interact with this environment. And you, as I've mentioned, you can do this as a screen-based simulation. So you can take the software home and actually use this as you are seeing now. But when you've got those virtual reality goggles on, it really does help with the learning. And I'll just show you a couple of things. So you can completely interact with the environment.
You're in the hospital because you're not too well at the moment.
Physical assessment tools
We'll
that you
find
can
out
use
what's
here.
going on and give you some treatment. Don't worry, you're in exactly the right place.
So that's what you can do with this type of simulation, and then you can.
Where's Janice? She's good with these sorts of things.
Hi, sorry, Josh. I think the warning is blocking the simulation. People can't see the simulation you're looking at. They can only hear it.
So they can just hear it. They can't see it.
Yeah, I think it might be in a different tab, maybe.
Oh, okay. Bear with me. Just bear with me 2 seconds. I may have to start that again. So let me start that again and hopefully we can go through. So can you see this now?
Yeah, we can see the page.
Go back into this one.
I think it might be because you're sharing just your... Oh, there it goes. Never mind.
Yeah,
Perfect.
I was showing the wrong screen before, so apologies for that. I'll just take you very quickly through this again so you could see exactly what I was seeing.
Hello there. I'm one of the nursing assistants here in the ED. I was wondering.
So as you can see here, you can completely interact with the environment that you've got within this virtual world.
I don't have any history on him, but he seems really confused. He was found wandering on the street. He's here on his own, but I think he has a daughter at home. He keeps asking for her.
Who are you? You're not Janice. What am I doing here? I really must get back to work.
Wilfred, you're in the hospital at the moment. You were brought in by ambulance to the emergency.
So if you imagine you were wearing your headsets in this scenario, you would be able to move your head and you would literally be able to see what was that virtual world, and you could interact with the scenario. You've got handsets, so you can actually press and you can try and get an allergy status from the patient, for example.
This place has clearly got something against me. You're holding me hostage. And
then once you've finished, you go to leave the scenario and you're taken through a self-guided reflection process where you can write reflections on the situation. So you start to reflect on your practice within that simulation. So how did you feel? What went well for you? What could you improve? And what actions would you take in the future to improve your practice? And once you've done that, then you get really good detail about your assessment that you've done, what needs to be improved. Obviously, I've just run through it, so it's not going to be good. And then you get an overall score. And you can do these simulations as many times as you want so that you can improve your practice over a period of time. The other piece of equipment that I'd like to show you, I've just got to swap over onto another computer again. So this is what I was talking about with the augmented reality headsets. So this next piece of equipment, when you come in, and like I said, we do drop-in sessions with this. So you can actually put it on and start to learn anatomy and physiology. Again, just bear with me while I swap over onto computers. So you can see this screen now. So this is a piece of technology called Biomedics. And what this mannequin allows you to do is that you've got an ultrasound probe here and you can place it over a mannequin that we've got and you can start to see the internal structures of the body. And this is what I was saying, whereby this really brings the textbook to life in the sense of that you've got a diagram showing you in on a textbook or even on a computer, but then you can go into this and you can really start to see different aspects of anatomy and physiology and helping you with the internal organs. So this is some technology that we're really going to start to utilize with you in first year to try and help complement the sessions that you'll be having. We're likely to be using webinars from September, so you'll be learning online, and then there'll be videos like that you can see now that really go into detail about anatomy and physiology. As you then start to progress to second and third year, what this technology can also do is that it also produces pathophysiology, which is basically the disease process. So what we can do, we can set up this machine so that there's a problem with the heart and you can actually see what is wrong with it. So it gives you a really good understanding of what is going on within the body. And once you've got that understanding, it can really help with that practice when you're going out into your placement areas and starting to learn more. So we do really offer these sessions, and I've done many sessions with one-to-one students with those that need that little bit of extra support with learning anatomy and physiology. It is an extremely complex topic, so we're all very happy to be offering one-to-one sessions for those people that do need it. I'm going to stop screen sharing again. So yeah, that was just a very quick introduction to what equipment we've got to offer in the clinical skills lab at Middlesex University. So if you've got any questions, please do drop them in the Q&A session and we'll be very happy to answer them.
Well, thank you, Mariama and Joss, for that informative and insightful presentation. We've had lots of questions in the chat function and in the Q&A function, which is really great. We may not be able to get through them all, so any questions we don't get, please go onto the UniBuddy chat function and ask those questions there. But first question was from, it was, first question was from, so it says, can I ask questions regarding the recognition of prior learning assignment for mental health nursing? If so, I'd like to know if the postgraduate course is 120 credits, but if you could potentially get 90 credits from the ROP, and how long would the remaining 30 credits be studied for? Would it be less than a year?
If you're doing the postgraduate, which is the only postgraduate nursing course that we do is the postgraduate
Mariama,
diploma.
I don't think that you're, I think it's muted, sorry.
Can you hear me?
Yeah, you're fine.
Okay, all right, sorry. So
no, we still can't hear you, sorry.
I think we can hear her, Josh. It might be your speakers.
It just might be you, Josh. I was just saying to the person who raised that question.
Mariama, is it your microphone?
Josh, we can hear Mariama.
Okay, sorry.
All right. Okay. So as I was saying, the only program is the postgraduate mental health, which is 2 years. Because it is the equivalent of the 3-year program, but condensed into 2 years, that you do need to have the undergraduate degree. What I would suggest, whoever's raised that question, if you go into Unibody, because the 2 mental health lecturers that also lead the postgraduate mental health course are there, and they'll be able to give you a little bit more detail as well about the recognition of prior learning. You can actually direct message them and have that discussion, have that discussion with them on a personal level rather than going on the group chat that's on Unibody.
Thank you, Mariama, for that. We have another question, and it is, when is the deadline for the first formative attempt of the ROP and the final attempt?
Well, if that is in relation to the recognition of prior learning, again, usually that should have been, it's usually done in the summer, but I can't give you a definitive answer because it is the mental health program. And I think the best person would be to directly discuss it with Nikki and Adrian, who are currently on Unibody at the moment.
Thank you. Another question is, are other non-nursing or medical degrees recognised when applying?
If that is for the postgraduate diploma, yes. You don't have to have specifically an undergraduate degree in nursing or in a science subject. It obviously does help to have that, that background, but they do accept other qualifications for your first degree.
Thank you very much. How many midwifery courses do you have per year?
When you say midwifery courses, we only have, there's the shortened midwifery course, which is 18 months, and then there's the full 3-year degree, and they both start in September. And I think the midwifery department are doing a presentation at 1 o'clock. So if you're inquiring about midwifery, it would be advisable for you to go to their presentation at 1, where they're going to give a good overview of their program. Midwifery is very different to nursing.
Thank you very much for that. What bridge program do you have for a nursing associate that wants to then go on and be a staff nurse?
Okay, so if you're a nursing associate, so you would have already have completed 2 years and have registered with the NMC. So we do have a 2-year BSc apprenticeship nursing program. So we do recognize the prior learning from the nursing associate program, and then you'll do 2 years as an apprenticeship on our main BSc program, and you'll have to undertake all of the year 3 modules and then some of the year 2 modules.
We have another question, and it is this program applicable to someone studying mental health nursing?
If you're talking about the BSc nursing, yes, it is applicable. My presentation at the beginning is applicable for the whole of the BSc pre-reg nursing program. The program, it is the one program, but then, and you all study the same modules. The difference is that when you're studying all of the modules that we deliver, it is in the context of your field of practice. The standards that are from the NMC are very generic in terms of the outcomes for all nurses, irrelevant of your field of study. So that's why we have a curriculum that covers across the 3 years. It covers the same topics, but when you're learning about those topics and when you're undertaking those modules, you'll be studying them in the context of your field of practice. And the delivery will be from lecturers that are in your field of practice. So that will be the mental health team will deliver the mental health program. The children and young people's nursing team will deliver the CYP program, and the adult nurses will deliver the adult program.
Well, thank you for that, Mariam. And that's
You're welcome.
All we have time for today. So if you'd like to continue conversations, I know there was a lot of questions. We just don't have time to go through all of them today. So if you want to head over to the Unibuddy chat room, I'll add the link in Q&A in the chat function to that chat room. You can carry on asking questions and hopefully we can get through all of them there. But thank you again to Mariama, Josh and Fiona for all your time and all your insightful information.
You're welcome, and I'll be over in the Unibuddy chat room as well.